This is your skin treatment cheat sheet. I have made you all the ultimate skincare guide to understanding skin treatments because too many people are confused by them. They get sold on the wrong treatments, they waste money, or even worse, end up messing up their faces. Welcome to episode 1. This is going to be a multi-part series. You're definitely going to want to follow me to keep up with future episodes. And if you are new here, by the way, my name is Karen, and you can consider me your beauty encyclopedia. I pretty much try all the things so that I can help you in your own journey. Class is in session. Let's go. You're going to come to learn that I talk too much, but I also give a lot of information, so I like to think it's a fair trade-off. Alors les amis, on va commencer la série avec les basics. And I say basics because who hasn't heard of the term tox or filler, okay? And I feel like we need to start off this series by clarifying what these things do and what they don't, because there is still this massive misconception. I get it all the time in my inbox of people thinking that these injectables are the solution to all of their anti-aging and skin health concerns. Sweetie, that is not how it works. These things are band-aids at best. So what I'm getting done here are neurotoxin injections. Neurotoxin injections are basically something that you get that will limit the nerve signaling to your muscles. In other words, they will freeze your muscles for a certain amount of time, usually around 3 months. And there are different brands that make this product. So Botox has become the household name, but there is also Dysport, Xeomin, and a few others depending on where you're from. In case you care, I have a preference for Dysport personally. Now, why would you get this done? For a couple of things. When the muscle is actually frozen, okay, if you have static lines, so wrinkles that are always in your skin, it can actually smooth those out. Keyword, temporarily. They will come back when it wears off. So it's not actually doing anything inherently to improve your skin quality. But it's really lovely because people don't like those lines. The other reason that people get it done, and this is one of the reasons why I started it younger, is because when you freeze these muscles, you actually prevent the skin from constantly folding. And if you can prevent the skin from constantly folding, so from like having the ability to frown all the time, you can actually reduce or at least delay how deep those lines will eventually become static in your face as you continue to lose collagen and elastin as you age. So this is where the term like preventative tox kind of comes from. I can get into a whole other conversation about doing this responsibly and like treatment frequency and all of that. Let me know if you want a whole other video on that. I got a lot to say, but we're not going to talk about that here. There's also some cosmetic uses to doing this. So depending on which muscles you target, you can actually get yourself like a little bit of a lip flip. You can get a little nose tip lift. You can get like a Nefertiti lift. There's like a few different cosmetic uses as well. Yeah, it's all temporary. It wears off. It's a cyclical thing. It's not improving your skin health. It's not stimulating collagen. It's not stimulating elastin. It's not making your skin inherently firmer in any way. It's kind of like a tool, but it's not the solution. Stay tuned for episode 2. We're going to talk about fillers.